Okay, we're going to show you how to do a subcutaneous injection today. So first thing you need to have your vial of medication, an alcohol wipe, and a syringe. Now, these syringes are a little bit different, and I wanted to show you both of them because the pharmacy may ship you a different size depending on what your dose is. But each syringe is measured by units. So this is a 30 unit syringe, and then this one is a 100 unit syringe. So if your dose is less than 30 units, it's very probable that the pharmacy will send you a smaller syringe. But either one is fine to use. The measurements are going to be the same. So 16 units on this one or 30 units on this is the same as 30 units on this. For today, I'm just going to show you with the small syringe. So I have that, the alcohol wipe, and the vial of medicine. So before I do anything else, I'm going to clean my hands, and you can use hand sanitizer or you can use soap and water. If you have a new vial of medicine, it's going to have a cap on it, and that cap you're going to pluck off with your thumb. That cap will never go back on, that's trashed. You're going to take an alcohol wipe, and you're going to clean the top of the rubber stopper with the alcohol wipe. Just wipe it down. With the syringe, it's got two ends. The short fat end covers the plunger. The plunger is the thing that goes up and down where we drop the medicine. The long skinny end covers the needle, and we're going to pluck that off. This needle will go into the rubber of the vial. Flip the vial over, and then you're going to draw up the prescribed amount of medication. So in this case, I'm going to show you, I'm drawing up 16 units. Now what I'm doing is I'm looking at the top of the black plunger and bringing it down to the hash mark that would represent 16. So that's just one hash mark underneath of the 15 here. And that looks about right here. And then you can just take the needle out. You don't need to necessarily turn it back over. Now while you're preparing your injection, if you need to set the needle down for any reason, go ahead and just rest it in the cap and set it down so that it's not touching anything dirty. Now for the next part, we're actually going to inject it into the stomach. So what you'll do is you're going to find a place on your stomach that is at least like an inch or two away from the belly button. You don't want to inject right next to the belly button. So I'm going to kind of just do it over here. You're going to take another alcohol wipe and you'll clean the skin. Let it dry. Then you'll pick up your needle with the medication, and I want you to hold it like a dart or a pencil. I don't want you to hold it with your finger on the plunger already because you may accidentally inject too soon. So I'm holding it like a dart. I'm going to pinch the fat to make kind of the skin kind of taut, and I'm kind of going at a 90-degree angle. I'm going to go straight in, 1, 2, 3, poke, and then I'm going to push the plunger down to inject all of the prescribed medication, and then pull out. You may end up getting a little blood drop, and that's completely normal. You would just wipe it off with a little alcohol, and it kind of just depends on if you kind of hit something like near a capillary or whatnot, but normally you probably won't have any blood or anything. And then that's it.